Hi, good day. I'm Mr. Muhammad Zulhusni Suhami, lecturer of Dietetic from Faculty of Science, University Tunku Abdul Rahman, Utah. So today I'm going to present about the nutrition care process. So this is the outline of my presentation. So in this lecture, I'm going to explain about first of all, I'm going to give the definition of the nutrition care process. And I'm going to explain one by one the component of the nutrition care process, which include nutrition assessment, nutrition diagnosis, nutrition intervention, and nutrition monitoring and evaluation. Let we have a look what's meant by the nutrition care process, or in short term we call it as a NCP. The nutrition care process is a systematic method that dietetic and nutrition professionals use to provide nutrition care. In 2003, the House of a Delegate of the Academy of Nutrition of Dietetics, which is formerly known as American Dietetic Association, have adopted the NCP in an effort to provide dietetic professionals with a framework for critical thinking and decision making. This NCP is usually summarized by the nutrition care process model, which is I will show you in the next slide. The use of NCP does not mean that all clients get the same care, but NCP will provide a framework for professionals to customize the care, taking into account the client's needs and value, and using the best evidence available to make the decisions. By using NCP, it can lead to more efficient and effective care and also nutrition research. Other than that, it also can lead to greater recognition of the role of dietetic and nutrition professionals in all settings. So there are 4 steps in nutrition care process, which is nutrition assessment and reassessment. The second one is nutrition diagnosis. The third one is nutrition intervention. And the last one is nutrition monitoring and evaluation. So in short term, we call it as a ADME. So this is how the nutrition care process model looks like. So it consists of a few components. So let me have a look. The first one is let we have a look the central component of this model. The central component of the model is the relationship of the target client or the group and the registered dietitians and nutritionists. The two outer layers represent the skill and ability of the registered dietitian and nutritionist, along with application of evidence-based practice, application of code of ethics, and knowledge of the registered dietitian nutritionist. And the second outer ring represent environmental factors such as healthcare system, socioeconomics, and practice setting that impact the ability of the target group or client to benefit from the registered dietitian nutritionist services. Other than that, screening and referral and outcomes management are also a component of this model. Next, let we have a look in terms of the nutrition care process versus medical nutrition therapy, which is MNT. A lot of healthcare professionals confuse between NCP and MNT. Actually, MNT is not synonymous with the NCP, but it is one of the specific type of nutrition care. MNT is defined as an evidence-based application of the nutrition care process that may include one or more of the following, which include nutrition assessment or reassessment, nutrition diagnosis, nutrition intervention, nutrition monitoring and evaluation that typically result in the prevention, delay, or management of the disease or patient conditions. Let me have a look the first component of the nutrition care process, which is nutrition assessment. By definition, nutrition assessment is a systematic approach to collect, classify, and synthesize important and relevant data that needed to identify nutrition-related problems and their underlying causes. This step also includes reassessment for comparing and re-evaluating data from the previous interaction to the next, and collection of new data that may lead to new or revised nutrition diagnosis based on the client's status or situation. Nutrition assessment also is an ongoing dynamic process that involves initial data collection and continual reassessment and analysis of the client status compared to the accepted standard, recommendation, and also goals. So the main purpose of the nutrition assessment is to provide the information needed for diagnosis nutrition problem and designing a nutrition care plan and also follow up. It will help to determine whether the care plan has been effective. Ideally, the assessment should be sensitive enough to detect subtle nutrition problem and specific enough to identify problem nutrients. For most nutrient imbalance, a variety of tests are necessary to identify nutrition problems. We may get the data to do nutrition assessment from the screening or referral form, from the patient and client's interview, from the medical or health records, from the consultation with other caregiver, including family members, community-based surveys and focus groups, and also from statistical report, administrative data, and epidemiology studies. So, in preparing or in doing or in performing nutrition assessment, we have to include 5 domains or 5 items in our nutrition assessment. First one is food or nutrition related history. Second is anthropometric measurement. Third is biochemical data, medical tests and procedures. Fourth is nutrition focused physical finding. And the last one is client history. So the item that we can measure or we have to consider when we try to evaluating the food or nutrition related history, so we may consider a few items, include food and nutrients intake, food and nutrient administration, medication, complementary alternative medicine use, the knowledge and belief, the food and supply availability, physical activity of the patients, and also the nutrition quality of life. For the anthropometric measurement, a few items that we can consider or we can include the height of the client or patient, the body weight, body mass index, growth pattern index, percentile rank, and also weight history. For the biochemical data, medical test and procedure, we may have a look in terms of the result of the lab data includes the level of electrolytes, the level of blood glucose, and so on. And we also can consider the result from lab tests includes gastric emptying time, resting metabolic rate, and so on. For the nutrient-focused physical finding, we may have a look on the physical appearance of the patients, muscle and fat wasting, swallowing, function, and also the patient appetites. For the client or patient history, there are several items that we may consider. First one is personal history, include age, gender, race, ethnicity, language, education, and so on. The other thing that we may consider is the medical and health history, for example, like surgical history. The other thing that we may include is family history, either their family got any history of in terms of the medical or health problems that may be inherited to the patients. The other thing that we may consider is include the treatment and complementary medicine use before, and also their social history includes economic status, housing situation, domestic issues, occupational, and also their religions. Let me have a look the second component of the nutrition care process, which is nutrition diagnosis. So that nutrition diagnosis is defined as a nutrition and dietetic professional identification and labeling of an existing nutrition problems that the practitioner is responsible for treating. Please be noted that nutrition diagnoses are different from the medical diagnosis. The simple example, the differences between nutrition diagnosis versus medical diagnosis include nutrition diagnosis is include inconsistent carbohydrate intake, and the medical diagnosis is the simple example is diabetes. So from this slide, we can see this triangle shape. It actually represent, or it is the symbol for the nutrition. This symbol for the diagnosis. Next, let we have a look how we're going to determine a nutrition diagnosis. Nutrition and dietetic practitioner use standard nutrition diagnostic terminology to label the client nutrition diagnosis through organized nutrition assessment data that are clustered for comparison with defining characteristic listed on the reference sheets. The terminology for nutrition diagnosis is organized in three domains or in three categories. Include, first one is the intake, the second one is the clinical factor, and the third one is the behavioral and also environmental factor. For the intake factor, we may consider or we may have a evaluation. Either the patient have too much or too little of a food or nutrient compared to actual or estimated needs. For the clinical factor, we may consider the nutrition problem that relates to the medical or physical conditions. And for the behavioral factor and environmental factor, we may consider the knowledge, attitude, belief, physical environment, access to food, and also food safety. So what is the standardized language that being used in doing nutrition diagnosis? So this is one of the example that provided by the American Dietetic Associations. How we going to write the nutrition diagnosis? So this is the standardized language for the nutrition care process, to be specific, in preparing in writing the nutrition diagnosis. So the example includes excessive alcohol intakes, inadequate energy intake, inadequate food intake, inappropriate infusion of parenteral nutrition, increased calcium needs, and inconsistent carbohydrate intakes. For the clinical diagnosis, the example of the standardized language includes altered blood potassium level, altered GI function or constipation, breastfeeding difficulty, food and food medication interaction, involuntary weight gain, swallowing difficulties. And for behavioral and environmental diagnosis, it may include disorder eating pattern, impaired ability to prepare meals, limited access to food, physical inactivity, self-feeding difficulty, and undesirable food choices. So, nutrition and dietetic practitioner, they will write the nutrition diagnosis through a method we call it as a PAS, which consists of problem, etiology, and also sign and symptom segment. So this PAS statement is to describe each problem, the root causes, and the assessment data that provide evidence for the nutrition diagnosis. The format for each PAS statement is begin with the nutrition diagnosis term problem related to etiology as evident by sign and symptom. So for the problem or nutrition diagnosis term, we may describe alterations that happen in client nutritional status. And for etiology, we may mention the cause or contributing risk factor and link to the nutrition diagnosis term by the word of related to. And for sign and symptom, it refers to the data or indicator used to determine the client nutrition diagnosis. So it is linked to the etiology by the word of as evident by. Or in some NCP notes, some dietitians, they just write in short term AEB, which means as evident by. So this one of the example how we write the nutrition diagnosis. So this is one of the example of the how we mention specifically about the problem or nutrition diagnosis term in the nutrition diagnosis. For example, like involuntary weight gain, and it's related to chronic use of a medication which is corticosteroid that causes weight gain, and as evidenced by unintentional weight gain of 10% of body weight over the past 6 months. So the full term will be like this: involuntary weight gain related to chronic use of medication corticosteroid that causes weight gain as evident by an unintentional weight gain of 10% of body weight over past 6 months. Next, let me move to the third component of nutrition care process, which is nutrition intervention. Nutrition intervention is defined as a purposely planned action designed with the intent of changing a nutrition-related behavior, risk factor, environmental condition, or aspects of health factors to resolve or improve the identified nutrition diagnosis or nutrition problems. Nutrition interventions are selected and tailored to the client needs by planning and implementing appropriate interventions. So how are we going to determine the nutrition intervention? As we know, the nutrition diagnosis and its etiology will drive the selection of a nutrition intervention. The nutrition intervention is typically directed toward resolving the nutrition diagnosis by altering or eliminating the nutrition etiology. Less often, it is directed at relieving the sign and symptom of the nutrition problems. Nutrition interventions goals ideally develop collaboratively with the clients, provide the basics for monitoring progress and measuring outcomes. In planning the nutrition interventions, we may consider a few factors. First one is we have to prioritizing nutrition intervention based on urgency, impact, and available resources. Next, collaborating with the clients to identify goals of the intervention for each diagnosis, and we may write a nutrition prescription based on a client customized recommended dietary intake of energy or selected food or nutrient based on the current reference standard and dietary guidelines and a client's health condition and nutrition diagnosis. Selecting specific nutrition intervention strategy that are focused on the etiology of the problem and that are known to be effective based on best current knowledge and evidence. And the last one, defining the time and frequency of care, including intensity, duration, and follow-up. In implementing the nutrition intervention, it will involve several phases. Includes collaborating with the clients to carry out the plan of care, communicating the nutrition care plan, modifying the plan of care as needed, following and verifying that the plan is being implemented, revising strategy based on the changes in condition or response to the intervention. So, in writing the nutrition intervention, we may use a few terminologies. And the terminologies for nutrition intervention is organized in 5 domains or categories. Include food and nutrient deliveries. Second is nutrition education. Third is nutrition counseling. Fourth is coordination of nutrition care. And the last one, population-based nutrition action. For the first factor, or the first item, food and nutrition delivery, we may customize approach for nutrients provisions. For nutrition education, it will involve or it refer a formal process to instruct or train a client in a skill or to impart knowledge to help client voluntarily manage or modify food, nutrition, and physical choices and behavior to maintain or improve the health condition. For the third item, which is nutrition counseling, it is refer a supportive process characterized by a collaborative counselor-client relationship to establish nutrition and physical activity priorities, goals, and action plans that acknowledge and foster responsibility for self-care to treat an existing condition to promote health. For the fourth item, which is coordination of nutrition care, it is referred to consultation with referral to or coordination of nutrition care with other healthcare providers, institutions, or agencies that can assist in treating or managing nutrition-related problems. And the last one is population-based nutrition actions. It refers to consultation with, refer to, or coordination of nutrition care with other healthcare providers, institutions, or agencies that can assist in treating or managing nutrition-related problems as well. There are some additional tips in performing nutrition intervention. First one is, please note that nutrition intervention used by the dietitian must be evidence-based, which is they are based on scientific rationale and supported by the result of high-quality research. Next is the goal of nutrition intervention are stated in terms of measurable outcome, such as the result of laboratory or anthropometric tests. For example, goal for an overweight person with diabetes might include the target range for blood glucose levels and body weights. The other thing is we may consider the other desirable outcomes include positive changes in dietary behavior and lifestyle. For example, like the diabetes patient may need to learn how to control carbohydrate intake or portion size and may benefit from regular exercise. So this outcome can be assessed during an interview with the patients. Let's we move to the last component of the nutrition care process, which is nutrition monitoring and evaluation. Monitoring the patient progress and periodically evaluates the effectiveness of the nutrition care is referred as a nutrition monitoring and evaluation. So the purpose of nutrition monitoring and evaluation is to determine and measure the amount of progress made for the nutrition intervention and whether the goal or expected outcome being met. By doing so, usually it involves comparing relevant outcome measures, for example, like result of blood test, with the initial values and meeting with the patients to learn whether the plan has been satisfactory from the patient points of view. Such follow-up effort can reveal whether the care plan needs to be revised, as is often the case when a person's situation changes. For example, like after a pregnant woman delivers her baby, she may need instruction on how to feed her infants or how to modify her diet to support lactation if she is breastfeeding. So she can return to healthy body weights. If a follow-up meeting with a dietitian is not possible, a dietetic technicians or other qualified health professional should provide additional guidance and education. So, in summary, nutrition care process or NCP, it will involve four items or four major steps, which is nutrition assessment, nutrition diagnosis, nutrition intervention, and the last one is nutrition monitoring and evaluation. Please note that each step of nutrition care process must be documented in medical record, providing a record for the future reference and facilitating communication among members of the healthcare teams. So this is example how the dietitian write the nutrition care notes. That's all for this presentation. Thank you.